Welcome back, everyone. The FDA is warning the popular antibiotic Amoxicillin is in short supply as RSV cases increase nationwide.
While amoxicillin isn't used directly to treat the respiratory virus, it can be used to help treat secondary bacterial infections.
The antibiotic is also used to treat ear infections, pneumonia, bronchitis, among other illnesses a lot of those kiddos get. Dr. Dominic Lucia, the Chief Medical Officer at McLane Children's Hospital, standing by, joining us now live this evening. Thank you for being here, Doctor. First of all, can you tell us more about the national shortage of amoxicillin? It's a real concern.
Yeah, it is a concern, Chris. I think right now most of the companies that make it have put it on allocation, which basically means that there's a shortage, but they're still able to keep up with supply with the various companies coming on and off allocation of amoxicillin. But it really is a warning sign that we need to be careful on how we use this drug moving forward.
So can you tell us when it is appropriate for treatment of infections to involve antibiotics?
Absolutely. So the key here is distinguishing between viral infections and bacterial infections. So bacterial infections, like we talked about earlier, ear infections, strep throat, pneumonias, those are bacterially caused and do need antibiotics such as amoxicillin. But oftentimes those can get confused in viral infections, which can just be congestion, cough, runny nose, even with a fever. All those require is supportive care. We don't need to use antibiotics on those, and overuse can be really dangerous.
All right, doctor, you know, these viruses can be very tricky. Of course, a lot of things don't work on them. They just have to run their course. So can you explain what antibiotic resistance is to our viewers?
Yeah, antibiotic resistance is actually quite a big deal. We deal with this in the hospitals and in healthcare every day. What it involves is because the overuse or inappropriate use of antibiotics on a public health setting, some of these bacteria have actually mutated and become very dangerous and are resistant to a lot of our normal antibiotics. So when you do get a particular infection with the mutated bacteria, you often need IV antibiotics long-term course, which has been caused by overuse and inappropriate use of antibiotics.
Wow.
Well, I know I have 4 little ones at home and a lot of parents are watching. So what can parents do to help with this shortage?
Yeah, I feel that pain. I have kids myself that have been sick often this winter, but I think when they go into the doctor's office and you take your kid into the doctor's office, I think it's important to ask questions, educate yourself. If you do get written a prescription for antibiotics or the physician suggests that, say, do we really need this? Do you think this is bacterial or viral? We don't want to just do it because it feels like we're doing something. So you really want to be an ally with the provider and physician on whether the child really needs an antibiotic for that particular illness.
Dr. Dominic Lucia with McLane Children's Hospital, thank you so much for being here. We've talked a lot about RSV this fall. As we get deeper and deeper into the winter, we hope you can keep us updated on what parents out there need to look out for. Thank you so much.